let's talk about some other things that we want to consider when we're talking about what types of drugs would be the best for the patient. The goal is to get an effective amount, so it needs to have that efficacy, an effective amount of the drug, but it needs to get to where the infection is. Our body, once we immediately put a drug in there, a chemical that should not be there, our body immediately starts to break it down and get rid of it. So we need to get a dosage of the drug that's effective, that can kill the pathogen, to the site of the infection before our body gets rid of it. All right, so there are different ways we can administer drugs. If we have a skin infection, the best way to do that is a local or a topical therapy. If you can get a cream or something that you can rub just on the area, you can use a higher dose because you don't have the drug going through your whole body. There's less chances of side effects. What side effects you have may be localized to the skin. So many types of infections that are surface infections, vaginal infections, if you can use a topical cream, that is usually the best route of administration for that, to get an effective amount of the drug right to the site of the infection to get rid of it. All right, what if it's not in an area that's easily accessible? What system moves through the body and can take this drug anywhere? Well, that's your circulatory system. So the fastest way to get a drug moving through your body is directly introducing it directly into the circulatory system. So this is the intravenous administration, an IV. You can get that drug directly into the circulatory system. You get that moving through the body at a high concentration very quickly. And so that's really good. So if you've got a systemic infection throughout the body, if you have something that's internal, different organs, this is the fastest way to get there. But why don't we give all drugs by IV? Are there negatives to IV? I think in your mind you can come up with some negatives immediately to an IV. We don't want to be stuck in the hospital. We don't want to have to deal with an IV. You need a medical professional to get an IV. So you've got something stuck into you, your mobility is limited, you have to be in a hospital setting to get the drugs. Those are all negatives from that. Can be painful for that. So there are definitely some negatives. The other thing we have to be worried about is as a medical professional, you just took a needle and pierced through the skin, which is our best method of protecting ourselves against infection. And now, not only did I pierce through, but I'm going to leave that in. I now have an open source that could be targeted by other infections, contamination from other bacteria, and we can add more problems. So catheters, IV, those types of things, we have to be concerned about that too. So if you have a patient very sick, this is the fastest way to get them their medicine, which is why in a hospital they want you to do this. But if you don't have a patient that's sick, there's some other methods that may be better. All right, so what are our other options to get that into your circulatory system and to the site of the infection? Well, we can give you a shot. We can give you an intramuscular an injection from that. This doesn't go directly into the circulatory system, but it goes into the muscle, and muscle is highly vascularized, so it can move into the circulatory system very quickly. So this is a good way to get a good amount of medicine into the circulatory system pretty quickly. It's less chance of infection because it's just that one injection versus an IV. Takes a little longer than an IV, but again, pretty quick. Cons, do any of your kids want shots? No, we still need a professional. Now I know some people can give their own shots, but when we're talking about antimicrobial shot, something that's going to deal with an infection, typically we're talking about a shot that needs to be done by a professional. It's painful, so those are some cons for that. All right, other routes of administration. Oral administration. You'll see that PO, which is per os, so by mouth. This is when the drug is swallowed. Now, this is typical for most people that are not that sick, don't need to be hospitalized. You'll take a drug. Sometimes you'll go in, you'll have an infection, and they'll give you a shot and then follow it up by a drug. Cons on this shot is that you get the drug in there, but then there's no continuing dose of the drug. So a shot will bump you up really quickly, but then unlike an IV, I can't continue to add the shot. to add the drug. Oral administration, I can take another pill to get more drug in there. Now, I do need to get through the digestive tract, so we do need a delivery system. To protect it as it goes through the GI tract. It's going to take some time, needs to go through the stomach and then be absorbed in your small intestine. So that's going to take some time. You may lose some of this to the digestive process. So that needs to be taken account of. You have to take it again, just like an intramuscular injection. You've got to take it again because our body is going to immediately be breaking down this drug. Good pro is that the patient can do this on their own. Con is that the patient can do this on their own. Anybody forgotten to take a dose of your antibiotic? You're starting to feel better after a couple of days and then you forget. Or you're like, I'm better, I don't need to continue. So this leads to errors, failure to comply. So this is an issue with that. So let me go, we'll come back to the blood-brain barrier. Let me go to our charts here. This one, administrative method, we talked about the IV. IV gets a lot of drug into your system very quickly and can maintain it. We talked about an intramuscular injection, gets a good amount into your system very quickly, not quite as quickly, but pretty quickly, but you can't maintain it. What do you think? This one's not labeled. What do you think this one is? Yeah, you know, this is your oral administration from that. All right, let me go to my low-key whiteboard here and draw one of these. And again, the goal is to get the amount of drug in your system. We want to get it quickly into your system, and then we want to maintain it at an effective concentration over the period of time so that so to work and kill your pathogen, to inhibit the growth of the pathogen. So this is our goal from that. We may have time, if the patient's not very sick, to just do this orally. We may want to give them a shot and then followed by oral medication. They may be so sick that we do need to put them into an IV type of thing. But let me show you what happens if over time I'm taking the drugs and I'm following them, morning, afternoon, evening, whatever your drug schedule is, I will maintain this effective dose. If I miss a dose, what happens to my effective dosage in my body? Well, it's going to dip, and then I'm going to remember, and then I'm going to come back. So there gets to be a point if you start missing dosage where your effective concentration does not do the job. What's going to happen? Well, the pathogen's going to replicate. You're going to get, anytime you dip below this, you're going to get the pathogen replicating. So we do need to be worried about that. We need to be concerned about that. Patient compliance, education, making sure the patient is aware of that. There are some diseases like tuberculosis where you have to give drugs for 6 months. Compliance is really hard. A lot of times they make you come into the hospital so they can help monitor that, and they track patients down. Because anytime we dip below, we have replication. The pathogen is continuing. Anytime you stop taking it early and it drops down to 0, anything that was not killed is going to replicate. You can have that infection come back. And the ones that are left are the ones that are most resistant, the ones that were hardest to kill to begin with. And that can lead to our development of these drug-resistant pathogens. They were already pretty resistant. You added some antibiotics, you killed off the ones that are susceptible. They already had some mutations that made them resistant, and now they're going to grow and repopulate. We're going to get a lot more of those. So compliance is a really big deal in coming to do that. All right, what else do I need to say on that? All right, I think that's it. Okay, so let me, back to that one thing. I think this video is getting a little long, but stay with me. The blood-brain barrier, my A&P people, blood-brain barrier, what is that? This protects our brain, our spinal cord, and eye infections. It's very difficult for pathogens to make it past this blood-brain barrier. This is a protective mechanism. It's to keep our brain from getting infected by pathogens. So that's a good thing. However, if we do get an infection in the brain, you had surgery or you had something else, a pathogen that has a virulence factor manages to get into the brain through your eyes, through nasal passages, there are pathogens that can do that. If you have an infection in the spinal cord, you had a surgical procedure or a spinal cord injection. You had pain medicine, an epidural into the spinal cord, and something happened and you got contamination, you got an infection there. The fact that things don't cross easily makes it also hard to treat this. Unlike the circulatory system where we can throw some drugs in there to go through your body, the circulatory system won't, the drugs won't pass through this blood-brain barrier. So it makes these infections particularly challenging to treat. Not impossible, but challenging for sure. So keep that in mind. Okay, what else do we need to know? Let's go ahead and finish this. It'll be a little long video. We need to get the drugs out of our body, so keep that in mind. Our body, we said it's immediately breaking down. How do we do that? Typically, either we urinate it out, excretion, or we convert it. Our liver has lots of different enzymes that undergo metabolic pathways that convert a drug. We talked about alcohol dehydrogenase, converts alcohol, which is a toxin, which is a drug, and converts it into something else. So liver and kidneys. So if you have a patient that comes in and part of their medical history is decreased kidney function, or part of their medical workup, their kidneys don't work as well, they've had a transplant or they've had some other type of infection, they were born with one kidney, or their liver is damaged. These are things you need to know because a normal, typical dose to a patient who normally gets rid of it, their liver and kidney is functioning as it should be, can get rid of the drug at the dosage you prescribe. But if they have problems with elimination, a typical dosage could end up with a buildup of the drug in their system. They can't get it out as well, which could lead to some side effects and some problems with that. So it's important to know the elimination route when you're dealing with that as well.